Hello. The earlier we can spot sepsis and start treatment, the better. Unfortunately, sepsis is a condition that can be very difficult to identify in the early stages. This is because the first signs can be very vague. It can be even harder to recognise in someone who has difficulty communicating. You may care for a person with a learning disability or autism, and they may not be able to tell you exactly how they're feeling. Unfortunately, people with a learning disability have a shorter life expectancy than the general population. They're more likely than the average person to die due to an infection, such as pneumonia or sepsis. People with a learning disability may be at an increased risk of developing an infection due to their condition. Here are 3 examples of how people can be at increased risk. People with a learning disability can have difficulty with swallowing and can develop chest infections from food going down the windpipe rather than the food pipe. People with a learning disability are more likely to become constipated, which can lead to urinary tract infections. And they may also find it more challenging to get a drink when they're thirsty or to go to the toilet when they need to. This also makes them more likely to get a urinary tract infection. Someone who has a learning disability might find it difficult to tell you how they're feeling. Instead, you need to be alert to the soft signs of deterioration in their health. A subtle change in behaviour might be the first and only sign that someone is becoming unwell. As a carer, you may spend a lot of time with someone and get to know them very well. If you feel that someone isn't behaving normally, then this could be a sign that they're becoming unwell. As a carer, there are plenty of simple things that you can do to try to prevent someone developing an infection. Make sure that anyone who has swallowing difficulties is eating the correct type and consistency of food, for example soft foods, and is sat up whilst eating. Assist people with toileting and make sure that they're comfortable on the toilet. Help people look after their teeth by cleaning them and taking them to the dentist. Encourage people to drink plenty and stay hydrated. Encourage people with a learning disability and their families to have all of their immunisations. If you have any questions, please speak to your manager or a senior colleague.